Hey everybody, welcome back. I'm Matt Brown, and this is Dr. Andrew Vallo. We're here at Dental Unfiltered. Today we have an awesome subject for you guys: equity models for associates and executives. I know Andrew gets asked about this all the time. Somehow I get asked about it a lot. I'll be on with a client, and they'll be like, "I'm thinking about getting an associate. How do I do this?" I don't know why they ask me. I'm just the marketer guy, but I'll get the question. And I hear a lot of different things in the marketplace. I'm curious what Dr. Vallo's point of view is on it. I know that docs kind of have a perception of like bringing on an associate in equity, and there's a lot of anxiety around it. I think, it's just a straightforward thing, and there's times to do it, and it's time to do it. It's time to do it, and you have to figure out how. And I think there needs to be a talk about how do you approach this equity and how is it earned, and it's not just given, and kind of how this whole process works. It's got some really serious nuances to it. So, Andrew, tell me about how you approach equity positions, not just for associates, but also for executives, because everyone thinks associate. That's all they think. But you get these high level C-suites people helping you run your organization, and equity opportunity keeps the talent. So tell me a little bit how you approach this.
So the reason for this episode, guys, is because I have had a lot of you reach out to me on Facebook asking about how we do equity for my group. I've also had a few dentists that I just know that are friends text me and be like, "Hey, I know you've got some associates equity. Like, how do you do?" So I think this is a question that a lot of people are out there asking. Now, I will tell you, there's a lot of different equity type models out there with, phantom equity and different things like that. You can, you can pay a group like Polaris. They've got like where they'll literally do everything for you, white glove service and get everything lined up. I honestly, I use my dental attorneys. So Rob Montgomery, his group, and they worked with my CPAs at Elliott Davis. And so basically the people I was already using, that already knew my business inside and out. I kind of use them to create the structures that we offer, to create the, agreements and, to kind of help with advice as we were kind of sorting through everything. But so this is what we came up with. And guys, I guess, first of all, why offer equity in your practice? And I think while there are a lot of dentists that are interested in doing this, that are asking me about it, I think there's a lot of other dentists that are very opposed to the idea as well. I know some dentists that, say, "Oh, I would never give up any equity in the practice." But unfortunately, if that's your mindset, it's going to make it really hard to maintain those hungry, high performing associates. Typically speaking, this isn't 100% of the time, but typically speaking, those high performing associates are going to want some type of ownership equity, whatever it is, at some point in their career, whether that is with your office, whether they go somewhere else and partner, whether they go do their own startup. Usually, if they're that motivated, that ambitious, producing that well, they're going to want some kind of opportunity to have some of the fruits of the labor, some of the ownership, some skin in the game. So that's part of why we do this as a retention strategy. I mean, we've talked before about how important it is to have top talent. I think one of the biggest failures in a lot of dental offices that have associate dentists, one of the reasons that they aren't more successful is because they don't focus enough on finding that top talent. I mean, think about it. At the end of the day, guys, you can have a great team. You can have a beautiful office. You yourself can be a great producer and a great dentist. But if you bring in an associate who doesn't have a very well-rounded skill set, who, isn't great about patient communication, isn't great about diagnosis, I mean, you can train on some of these things. You can mentor, you can coach up. But I mean, at the end of the day, guys, it is kind of innate. Like, some people have that inner drive and some people don't. So, if you're just focused on, "Oh, I want an associate," and you're just looking for someone who's nice, and this is no knock on those associates. It's just, it's for the business owners out there. Just realize your growth of your practice is going to be limited by the ceiling of your associate. So we specifically seek out the really talented, broad skill sets, advanced procedures. And, we're looking for hungry, humble, smart. We're looking for people that are coachable, but are also like very hungry to succeed. Once we find those docs, I want to keep them in the group. I don't want them to feel like they need to go out and do their own thing. And so that's part of the reason why we offer these equity opportunities. Another part of the reason is it creates a more ownership mentality for those doctors. So if you've got some skin in the game, if you are, participating in profit distributions from the office, if you've got equity that can grow or shrink based on how the practice grows or shrinks, you're going to be that much more motivated to be a leader within the practice and make sure that things are running like they should, to make sure the office isn't wasting money on stuff. Even think about your own, decisions like, hey, do I really need this extra material equipment, this expensive brand, whatever? Do I really need that? Or is that just wasting money that's going to, creep into overhead? So I think it's a retention tool. I think it helps create ownership mentality so that your associates are just as driven for the practice to be successful, both in top line and bottom line, as you are. So how do we do it? Kind of getting back to the nuts and bolts. So we run a de novo model. So my group, we've got 9 offices now, soon will be 10. 8 of those 9 offices came with 0 patients. They were de novo startup offices. So, and they're all associate driven. And I don't personally go into these startups to kind of grow them. So, there is a doctor, and usually again, it's a very talented doctor who we convince this is the best opportunity for you right now. Go into this startup, help us grow this startup. And, at this point, we've got a track record. We can show them what our other docs are doing. We can show them what our other startups typically do in their first 12 months. But at the same time, if they're a really talented doc, they probably have they might be at an office where they're already producing a lot of money. And they probably have opportunities. There's probably a lot of other offices that want them too. And they can go into another office that's already established, that has safe production numbers for them, versus having to go in and essentially, they've got support and, I'm there making sure patients are coming in the door, but like they're essentially growing that office from the ground up. So what we do to incentivize them is we offer for docs, and this is only for the docs going in the startup. If they join an office that's already established, we don't have this offer on the table, but for docs going into a startup, they have the opportunity to essentially be gifted or earn 5% equity of the office after their first year. And there's not a whole lot of stipulations to earning it. We don't set specific metrics, production, whatever it is, or collections. All we say is, as long as after those first 12 months, we both feel like this is a good fit, we're going to give you that 5% equity. Now, if even before the first 12 months, if I don't feel like it's a good fit, if I feel like they're struggling to produce, struggling to convert, we've had conversations about it, their office is just not keeping pace with what we want to do, and it's not a new patient problem, and it's not a treatment coordinator problem, they're probably not going to make it the first 12 months. Now, we haven't really had that happen almost ever, and part of it is because we've got a very thorough vetting process for our associates, and when we find a doc and we think they're the right fit, we usually hit the nail on the head. They've got that personality, they've got that ambition, they've got that hunger. They're going to come in and they're going to produce. But at the end of the day, if we don't think it's a great fit, and I've never had this situation happen, but at the end of those 12 months, if we're just like, hey, this isn't the right fit, at that point, I guess we'd be letting them move on to another opportunity. I think because of our hiring processes, it's pretty unlikely. And I don't think it would get to 12 months. I think, after 6 months or whatever it is, at some point in time, we'd realize that this just isn't the right fit for us right now. Now, at that point, they have to think it's the right fit too. So, it's like, hey, are you happy where things are at? Are you happy with the track of where things are going? Because if we're going to go through this process of legally giving you 5% equity in the practice, we want to know that you're going to be here to stick around. And part of the way that we do that is that equity, if they decide to leave in the future, that doesn't go with them. So they don't, it's not a buyout or anything like that. That is gifted equity that they maintain as long as they're a full-time doc in the practice. So I think that first year really gives us a chance to kind of get to know, they get to know our group, our systems, how the offices run. They get to see the growth track that their office is on. And they get to decide, do I want to double down and do I want to stick with this group as a long-term partner and get my 5% of free equity? Or, is this not the right fit for me and I want to move on? Again, it's really rarely, almost never happened. We've had 2 docs in the course of 4 years. And at this current time, we've got like 12 associates. So we've had 2 docs in 4 years leave the group, both left. One left to do a startup, and one left to buy an affordable dentures practice. So basically, they decide they wanted 100% ownership, or they want it, they want, and that's fine. Hey, if that's how you feel, that's totally fine. But just know sometimes I think I make it look too easy. Practice ownership is not as easy as I think I sometimes make it look. But I always wish them the best. And, that's, hey, I hope they're very successful. I hope they learned a lot, while they were with us. But other than that, we don't have docs leave because of the earning opportunities, because of the equity opportunities. I mean, there's a reason our docs are in the top 1% for, many of our docs are in the top 1% of associate dentists as far as earnings go because of the production potential. It's a combination. It's a combination of the production potential that our group offers, as well as the type of docs that we're typically bringing in. So it's like a match made in heaven. I think this year we're going to have at least 4 doctors earn over 500,000 in take home pay this year, maybe 5. So I mean, that's like almost 40% of our doctors are going to earn $500,000 plus this year. It's crazy. So anyways, that's that 5% gifted equity. That's for docs going into new startups. There are strings attached in the sense that if they decide to walk away at some point in time, they don't get to take the equity with them. So once they get the equity, they get to participate in profit distribution. So typically those are done quarterly as long as there's profit to flow and we're not reinvesting the practice or anything like that. But typically those are done quarterly, and they'll get 5% of any profits that are distributed then from their office. Then at some point in time in the future, whenever that time may come, we decide to sell the group, they're going to get 5% of the value of their office in terms of the sale. So, it's pretty cool stuff. Now, that's that first model. The second model is those same docs, as well as other docs who don't go into startups, they have the opportunity after their first 12 months to purchase equity in the office. Any doc can own up to 25% of the office they work into, or they work in. So if they got 5% equity gifted to them, they can earn, or they can buy up to another 20% equity. They can also buy 5% additional equity, or 10%, or 50. So I mean, it's not like it's not all or nothing. They can also buy nothing. They can say, hey, I'm happy with that 5%. If they went into an existing office and they're not gifted equity, they can buy up to 25%. And I mean, if a doc wanted to, they could buy as little as 1%. I mean, some of our offices at this point in time, with the type of revenue, profit, EBITDA that's going on and the size of our group, they're pretty expensive offices to buy into. So they might just want to feel like they've got a little skin in the game, and they may just want to buy 1% or 2%. And that's totally fine too. They can also buy nothing. So there's no requirement to purchase equity. It is a opportunity for our docs. It's on the table for them. Now, how do we value that equity that they're buying? That's a question I often get. So what we do is, at the time that they're eligible to buy, we will create a valuation that's typically somewhere between 6 and 7 times EBITDA. So at this point, our group, 9 going on 10 offices, we're projecting a little bit over 15 million in top line revenue this year. We're projecting over 3 million in bottom line, EBITDA. So the size of our group, even in today's climate where interest rates are higher and multiples have come down a little bit, we would likely get at least an 8x on EBITDA, possibly a 9x, and we're working towards that point where we can get to a 10x EBITDA, and that's my goal. As we grow over the next however many years, my goal is to get our group to that size, the systemization, just have all those factors in place that these PE firms and larger DSOs are just absolutely looking for, where we can command that 10x plus multiple. And on top of that, my projection over the next few years is interest rates will come down some. If interest rates come down, money becomes cheaper, multiples are probably going to go back up, which will make it easier to get to that 10, 11x multiple as well. So anyways, 8x easy based on the size of our group right now, 9x very likely. We're giving them the opportunity typically to buy in at 6 to 7x. And there's not a set. Basically, my partner and I sit down, we talk about the office. We talk about, the growth trajectory, all that stuff. And we try to come up with what we think is fair kind of between those two numbers. So the nice thing for these doctors is when they buy in, their value of their equity immediately goes up. It goes up from a 6 to an 8x, or from a 7 to an 8x, or whatever it is, at least. So that they're seeing a small immediate bump in equity. We are selling the equity to them at a slightly discounted rate. And we do that because I I want to, reward them for the work they've done to grow the practice. And I want them to feel like they've got that upward potential right off the bat. Now, they're also going to get profit distributions and the percentage that they buy in for. They're also as the office grows, assuming EBITDA bottom line, assuming EBITDA grows, even if the multiple didn't increase, they're going to see an increase in the value of their equity because EBITDA grows. And as the group grows, if we can get to that 10x, they're going to see an even greater increase in the multiple. So, I have this conversation with every doc who's at that point where, they're considering buying in. And I say, at the end of the day, from a monetary standpoint, like Sasha, my partner, Sasha and I, we do better with the less equity you buy. We are selling you equity at a discounted rate. Now, again, there's no pressure. We're not kicking you out. There's nothing like that. You don't have to buy any of it. We don't really need the cash flow right now. But we want to give you that opportunity because, again, we want to create the long-term partner ownership type of mentality for our docs so that we can keep these really talented docs within the group.
Going back to one thing Andrew said earlier, he talked about like the hiring process and vetting process and how he picks these people up. Sometimes docs, when you're having problems with staffing, you focus on like, what is my hiring process? Now, Andrew does have a good hiring process where he hires pretty good qualified docs. But those same docs could go to practice too and not be the best doc in the world. After they're hired, you need a good mentoring, cultivating, a good polishing, a good process where you're investing in that individual and getting the most out of them. So a lot of times people focus on like, man, I got to have a better hiring process. Well, it's a hiring process all the way to developing the person to where you want them to be. If you hire right, but the rest of the stuff isn't in place after the hiring process, you're still going to have bad results.
Yeah, no, I mean, and honestly, I've talked to some docs that have made me kind of embarrassed about our onboarding process. I talked to a doc that owns 7 offices in Chicago, and they've got like it's like a 2-day onboarding intensive. They've got a whole onboarding manual the docs go through. They've got online modules they go through. Ours is not that extensive, but they also hire new grads and we don't hire new. So, I mean, part of the thing is I am looking for docs that are the 2 main things I'm looking for. And guys, we're constantly growing. If you're a doc who you feel like fits this and you're interested in the income opportunity, the equity opportunities, things like that, feel free to reach out to me. Emails docvallodds@gmail.com. But what I'm looking for in these docs is, one, a well-rounded skill set. I want docs, or for our general offices, I want docs that aren't afraid to do molar endo and like are comfortable doing we don't want to refer it out unless it's really complex. We want to keep it in-house. So they got to be comfortable doing molar endo. They've got to be at least fairly comfortable doing, full mouth rehab cosmetic cases because we don't want those walking out the door. And again, guys, you look for what you know how to do. If you've never done a cosmetic case, a full mouth rehab, you're not looking for those things on patients. Whereas if you have, you can at least have that conversation. Hey, has anyone ever talked to you about this? Invisalign's the one area where I am a little bit more lenient just because that's something that I do coach and teach our docs on. So like they don't have to be super experienced with Invisalign. Although I will say the couple docs we've had who have come in that have been more experienced, they tend to do more Invisalign out the gate. Because again, you look for what you do, you look for what you're comfortable in. So it is nice if they've got at least some experience with Invisalign, but that's one thing I will train them on. Our general offices now, we want docs doing at least like single implants. They don't necessarily have to do full mouth cases, but we at least want them comfortable placing single implants, extraction, surgical extractions, bone grafts. If they can do some wisdom teeth, that's a plus, not really a requirement, but that's nice. So basically we're looking for these docs that have that well-rounded skill set where every single, diagnosis that's out there, they're looking for it and they can offer to do it confidently in-house versus referring it out. The second thing I'm looking for is personality attitude. So again, humble, hungry, smart. I want someone that is ambitious. I want someone who's competitive, but like in a friendly, competitive sense. Like I do want our docs competitive, but I don't want them competitive to the point where they're going to be an a-hole about it or anything like that. I want docs that are empathetic and that care about people and that are going to care about our teams, because there's nothing that makes you more upset than hearing a doc is rude to their assistant or their hygienist or whatever it is. So really, those are the only 2 things I'm looking for. Do they have the skill set? And like, again, it doesn't have to be 100% of everything, as long as they're motivated and they're going to pick it up. We just hired a doc who's going to go get their IB sedation certificate. They don't have it yet, but they're going to do it. And they've already committed that to us, and they're going to do it on their own dime. So it was like the role we were looking for was a surgical doc, and we wanted someone with IB sedation experience. And we liked this doc this much with their attitude, their personality, the rest of their skill set, that we were like, hey, even though you don't have it yet, and we've had a few applicants that do, we think long term you have the most potential in this role. So we're going to go with you and just do it, and they've already, I think, signed up for that course. So skill set, at least fairly well-rounded, maybe with the interest in even expanding it further. And then attitude, personality, that type of a thing. Can they create rapport with patients? Are they going to be nice to the team? Can they create urgency and scarcity? Are they not afraid to sell the value of dentistry? Now we're not having our docs talk money with the patients. So don't get me wrong. We have our treatment coordinators. We've done a lot of episodes about that. We're creating a sophisticated sales team with our treatment coordinators, but it does kind of start with the doc. Like the doc can't be tiptoeing. They've got to be confident. They can't be tiptoeing around the issue. They've got to confidently tell the patient why they need the treatment they need, how it's going to improve their life, what the good of doing the treatment is, what the bad of not doing the treatment is, what the risks of delaying the treatment is. Like, they've got to be really good at concisely explaining that and creating that value, urgency, and scarcity of the patient. Those are the main things I'm looking for in these docs.
Yeah, I think it's a lot of weight when you start giving someone equity. Like there has to, I think one thing where docs really mess up is they hire an associate and they kind of have like a pretty undetailed plan on how they're getting the equity.
Oh yeah. Dude, I think it's the oldest story in the book. It is how many associate docs out there went to an interview, accepted it.
That need more planning, both sides of it.
But I mean, like, I think especially for those associates, because I mean, there's always been people offering partnerships, buy-ins, whatever. But like, I think a lot of times it happens where the doc's like, yeah, like, I'm definitely going to give you this opportunity within the first year or two or what. But like, everything's vague. There's no real commitment to it. But then like they get to that point and the associate asks them, they're like, hey, what about this? They're like, oh, I'm not ready yet. Like, let's talk about it. And like they keep pushing it off. Now here's the difference with me. I follow through. So I tell the docs after a year, when we hit that year mark, we have that conversation. And now again, if I'm not going to give them that opportunity, it's because they're not a good fit. So it's not like, hey, keep working for me, but I'm not going to give you this opportunity. It's more like, hey, you're not a good fit. We need, now again, this has rarely ever happened. And again, I don't think it would take a whole year to get there usually, but that's it wouldn't just be like, hey, I'm not ready to give up. Cause it's not that they don't want to give that person equity. It's that owner doc gets cold feet about giving up equity, period. And they don't want to do it yet. So like, that's the difference. That's that old story. That's why associates are so wary about equity opportunity.
I think associates feel led on after that. And I feel like docs ruin their associates. Like docs are like, I associate, he was great. Then all of a sudden he went to crap. I'm like, what do you tell him when you interviewed him for equity? Well, I told him we'll talk about it in the next 2 years. How long has he been there? 2.5 years. Have you talked about it? Well, yeah, I just told him I'm not ready. Yeah, he feels led on, dude.
So all you owner docs out there, I think, first of all, I think if you want to have associate driven practice, large practice, group of practices, multi-location practices, and you want to retain top talent when it comes to associates, you have to get okay with the fact. Now, again, you don't have to do 50-50 partnerships. We limit it, but I think 25% is enough equity in the office where they really feel like they've got some good skin in the game and some good potential for increase, in equity valuation and all, and they can earn some solid profit distributions and things like that. So I think 25% is a good number. You could do 10%. You could do 30%, so it doesn't have to be that exactly, but you could do 50%. Just keep in mind with the 50%, it does become a little trickier because now you guys are truly 50-50 partners and splitting the decisions. I tell our docs like, hey, as equity, I do want you to take ownership mentality, but like at the end of the day, like I am going to maintain like day-to-day operation decision making. Like I'm always happy to talk about things. I always take feedback from our associates. I always consider it, But like I've gotten where I've gotten because I've had the ability to make decisions when I want to make them. And I've got this big group now. I want to keep things congruent across the offices. I don't want to like totally change things at one office because I've got a 50-50 partner there and this associate, wants to, change how we do this or whatever it is. So it's just something to keep in mind. If you want to give more equity, just be wary. If you give up the full 50% at that point, technically speaking, you guys each own half, and every single decision, like truthfully, you kind of have to make together. And I think that's why a lot of partnerships go to shit, honestly, is because of that 50-50 split. When an owner brings on a 50-50 partner and they're not used to having to make decisions together with this person, and all of a sudden they've got to make the decisions together, and it creates animosity between the two of them. So I'm not saying it can't work. I do have a 50-50 partner on the big group on the implant side with Sasha. We're that yin and that yang where things work very, very well for us. And we knew that, I think, going in, just because we really knew each other's personalities. But if you're going to do a 50-50 split, make sure that you really, really know that person and have some conversations about how you're going to handle conflict ahead of time. So anyway, so that's our basic equity model for associates. Now, a couple other things I want to mention. Now, with the gifted equity, that 5%, if they leave, they just lose it. That's it. There's no buyout. With the purchase equity, obviously, they can't just lose it. They paid for it. But we do have in there in the contracts, if they leave, then basically they are forced to sell the equity back to us at the lower of either the purchase price or the current valuation. So again, and I tell them that, hey, go in eyes wide open. If you want to do this, if you want to purchase the equity, if you want the upside, go in with the mentality that you're going to be here long term and you're going to stick through, because that's the only way that you're going to really realize that gain in your equity. We're not looking for docs to buy in, grow the practice for a year or two, and then sell out and make money and leave. So like that, we don't put that opportunity on the table. And I'm very clear with our docs ahead of time that's, if that's what you're thinking of doing, don't buy equity, because you're going to do that. And then 2 years from now, you're going to sell it for the same price you bought it for. So the last thing real quick, and I know we got to wrap this up here in just a couple minutes, but I did want to talk briefly about executive equity. So if your group's getting larger, if you're starting to bring on C-suite type executives, operations, COO, CFO, those type of like major positions, you may want to consider the opportunity of offering some equity to that person. Now, if you have a single practice, you don't have a DSO structure like we are a privately doctor-owned DSO. We have created a true DSO structure. We've got a dental management company that all the offices kind of flow up to. So with the DSO structure, there are ways to actually offer little bits of equity to non-dentists. But in most states, if you just have a dental practice and it's not built out, you don't have like a DSO structure for it, you can't typically own part of a dental practice if you're not a dentist. Now, some states it's different. It's not every state, but in a lot of states that's the case. But there are other ways to do it. Even if like you've got a single practice or you got a couple practices, you're not set up for a DSO. There are some different ways where you can essentially offer the upside of equity without actually offering true equity. Now, if you have a true DSO, again, you can really do that. And that's something we're working on right now for a few of our key executive positions. Now, we are, for those positions, because they oversee the entire organization, I am going to be giving them equity at the parent level. So they get some equity for the entire. Now, it's a very, very, very small sliver of equity. And honestly, I think sometimes when people hear it, they're like, oh, like, is that really anything? But you've got to think, if you're growing a large dental organization, again, we went from 4.7 million a year, the next year to 8.9. This year, we're projecting over 15 million, and we want to keep growing from here. So, I mean, if you've got a large organization that's doing 15, 20, 50 million dollars a year, even a small sliver of equity at the parent company can equate to a lot of opportunity, especially if and when the time comes to sell the group. So, and for a lot of these people, they're not going to have this opportunity almost anywhere else. So if you get really great, hardworking, talented people in those executive positions, you may want to consider that. And I'm not going to go into a lot of detail about this right now. If you have more questions, feel free to send me an email about it. And I would not recommend this non-dentist equity to anyone that's got a, single practice, smaller practice, even if you got like 2 offices, this probably doesn't, I'm talking more to if and when you get to, or if you are at the point where you've got 6, 7, 8, 9, 10 offices or more, and you've got some key executive positions, you may want to consider that. Because again, just like your talented doctors, they're going to have a lot of other opportunities. And as much as they like working with you, they may decide that they've got a better career move to go somewhere else. If you can offer them a piece of equity in a big company, that's going to really motivate them to stick with you for the long haul. So that was it. I hope this was a helpful episode for those of you that have been asking about our equity models here. Again, if you have questions, feel free to email me. If you're enjoying the show, guys, please like, follow, subscribe, share with other dental friends you think might be interested. We really, it's been amazing how much our audience has grown over the last year and a half. And it's because of all of you doing these things. There's no sponsors. Matt and I have not made a single dime from this podcast, but we do really appreciate all the support. Thanks, guys, and have a great rest of your day.